Hi there, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. I wanted to welcome you to part 4 of this series we've been doing. It's called, Can Disc Herniations Actually Be Worse Than the MRI Shows? My question, as we've talked about in parts 1, 2, and 3, the question is, if a low back or a lumbar disc is 4 millimeters herniated when you're laying down in an MRI tube, well, what happens to that disc when you sit up and become weight bearing? Will the herniation increase or will it be affected at all? After some disagreements and discussions with some radiologists that I know, I decided I needed to try to dive into the research at PubMed.com and try to answer the question for myself. I'm hoping you found this series interesting, and I'm hoping it can help you decipher the information on your MRIs going forward. So let's start part 4 with a paper called Axial Loading During Magnetic Resonance Imaging in Patients with Lumbar Spinal Canal Stenosis. Does it reproduce positional change of the dural sac detected by upright myelography? That's a long title. The paper was done by Kano et al. Now here's why they did it. The objective was to answer the same question that I had. Does an axial loaded MRI change the anatomy of the vertebral segments, including the neural structures there in the area? Now here's how they did it. 44 patients participated. The imaging was done in a conventional manner and in an axial loaded manner. The size of the dural sac, or the sac around the spinal cord, was measured in each type of imaging, both lying down as well as sitting up weight bearing. Now here's what they found. The size of the dural sac was significantly reduced in the axial loaded imaging. The axial loaded MRI detected severe constriction with a higher sensitivity in 96.4% of the subjects and specificity in 98.2% than the conventional MRI. What does that mean? Well, let's wrap it up. MRIs performed with axial loads applied showed significant changes in the size of the dural sac diameters. The axial loaded MRI is useful in representing positional changes similar to those experienced when upright and weight bearing. Okay, next we're going to cover a paper called Axially Loaded Magnetic Resonance Image of the Lumbar Spine in Asymptomatic Individuals. Still a long title, but shorter than the first one. This paper was done by Danielson et al. In 2001, and here's why they did it. They wanted to evaluate the effect of axial loading on asymptomatic individuals when compared with the effect on patients who have clinical signs of lumbar spinal canal stenosis, and to assess the effect that different magnitude and duration of the applied load have on the dural cross-sectional area, or the diameter of the dural sac. And here's how they did it. MRIs were performed lying down as well as upright on the participants. The axial loading was performed lying down, face up, with a compression device made specifically for this study. Degenerative changes were noted in and around the spinal canal. The diameter of the dural sac was measured in the lying down and in the upright position. Now here's what they found. The author said a significant decrease in dural cross-sectional area from psoas relaxed positioning, or lying down, to axial compression in extension was found in 24 individuals, which was 56% of them. Most frequently at L4, L5, and increasingly with age. So again, what the heck does that mean? Well, let's wrap it up and put a nice little bow on it. Using axial loaded MRI imaging demonstrated a significant reduction in the size of the dural sac diameters, especially in the patients that were already suffering from symptoms. So, there you have it. Since beginning this series, we've covered 12 research papers dealing with this topic specifically. It is exceedingly clear that indeed upright or axial loaded MRIs are significantly superior to MRIs performed in the lying down position in regards to diagnosing herniated disc severity. If your MRI says 4 millimeters and was performed in the lying down position, then it is a researched reality that the actual size of the disc herniation will likely be variable and much more significant with weight bearing, bending to the side, bending forward, bending backwards, and performing activities of daily living and work responsibilities. Now, what can be done about these disc herniations? Does surgery have to be explored? What about spinal injections or pain meds? Well, not necessarily. And in fact, in many, if not most instances, a patient will benefit significantly, if not completely recover, from a full regimen of cold laser enhanced spinal decompression. I will put a list of resources in the video description for you so that you can learn as much as you want about spinal decompression and cold laser. Lots of links, so please go and do your due diligence and learn as much as you possibly can about it. It is literally the most effective thing I've ever seen. We hope you've enjoyed this series and found it interesting and educational. Please share this blog and help us get the word out about decompression and how it may help more and more avoid surgeries and potentially harmful injections. Subscribe to our channel here. Also find us online at our website, www.creekstonecare.com or www.amarillochiropractor.com. You can also connect with us through social media on Facebook, Twitter, Pinterest, Instagram, Google+, and just about anything else we could think of in the social media realm. So tell someone for us. We'd appreciate it. Till next week, I'm Dr. Jeff Williams with Creekstone Integrated Care, Amarillo, Texas.